It's kind of wild to think about, right? Like here we are, super connected online, but for a lot of people, just seeing a doctor is like this huge obstacle.
It is.
Yeah, just getting basic health care,
Mm.
it's a major challenge for so many. And in this deep dive, we're going to really try to get our heads around a brand new approach, something pretty fascinating that's trying to bridge that gap.
Yeah, absolutely.
So,
We've been looking at this 15B Rural Telehealth Platform, and basically it's all about getting quality healthcare to folks in rural areas, no matter how isolated they are.
okay, yeah,
And the really cool part is how they actually developed this platform.
right, with AI, right?
Yeah, exactly.
Using Eon Reality's AI-powered entrepreneur guide, I think.
That's the one. We've got a bunch of info about the platform itself, and what we want to do is walk you through it. Explore the problems it's tackling, how that AI development played a role, the key features, and what kind of impact it could actually have. We're aiming to give you a clear picture of what's going on here.
Awesome. So, where do we even start with this?
Well, I think the best place to start is with the challenge itself,
Yeah.
What is this platform actually trying to solve?
Okay, yeah, grounding ourselves in the problem.
Right. And the data we've been looking at, it's pretty stark. It paints this picture of healthcare access in rural India, specifically because that's where they're focusing first. Get this. Less than one doctor for every 1,000 people.
Wow.
And in some of the more remote parts, it gets even worse. We're talking less than one doctor for over 10,000 people.
That's, that's just crazy.
It's a huge disparity.
Yeah. But it's not just about the number of doctors, is it? There's also the whole issue of just getting to see a doctor when you live way out there.
Oh, absolutely. You hit the nail on the head. We're talking about logistics. And the information shows that on average, rural patients have to travel something like 30 kilometers, almost 20 miles, just for basic diagnostic tests.
Seriously.
Yeah, think about it. Just to get a simple blood test.
That's insane.
It is. Huge investment of time, money, especially if you're already sick or you don't have reliable transportation.
Right. And you can't really put a price on your health, can you?
No, you can't. And then think about emergencies. In those situations, those distances.
Oh, that's got to be a nightmare.
It is. The data shows that the average emergency response time in rural India is over 70 minutes.
Wow. Compared to what, like 15 minutes in a city?
Yeah, something like that. And those delays, they have a direct impact on people's chances of recovery.
That's scary.
It's life or death, literally. So you see, it's not just an inconvenience. This lack of access has really serious human consequences.
Okay, so that's the problem.
Mm.
Now tell me about this 15B platform. How is it different from just doing a video call with your doctor?
Right. Good question. This platform, it's described as an integrated ecosystem, and that's kind of the key here.
Okay.
It's not just about telemedicine, those remote consultations. It's a whole system designed specifically for the challenges of rural environments. So yeah, it includes video and audio consultations, obviously, but they've made it so it works even with slow internet.
Right, which is probably a big issue out there.
Huge issue. But that's just one part of it.
So what else is in this ecosystem, this platform?
Okay, so one big thing is AI-assisted symptom assessment.
AI, again.
Yep. Basically, it's like a smart first point of contact. Helps patients understand their symptoms and guides them to the right level of care. Then there's this whole digital record-keeping system. Keeps a patient's medical history secure and accessible to different providers.
So, no matter who they see, everyone has the same information.
Exactly. Continuity of care, which is really important in these areas.
Yeah, that makes sense.
And then they've got mobile health kits.
Mobile health kits, what are those?
So these kits are for distributed diagnostics. They give community health workers the ability to do basic tests right there in the field. No more 30-kilometer trek to the clinic.
Oh, wow.
Yeah.
So they can do blood tests and stuff right there?
Yeah, certain tests right on the spot.
That's amazing.
It is. And then last but not least, there's a whole emergency response coordination system built in.
Like 9/11, but better.
Kind of. It connects people in emergencies with local transportation and medical help much faster.
Okay, so this is way more than just video calls. It's a whole interconnected system.
Exactly. Tackling multiple problems at once.
I'm really curious about this AI-powered entrepreneur guide thing. You said that's how they developed this platform.
Yeah, that's what makes it so unique. It's like this blend of social mission and a really structured development process.
Okay.
The person behind this, the entrepreneur, they were driven by this goal of making healthcare more equitable.
So like a real passion project.
Totally. And then the AI guide gave them a framework to turn that passion into a real solution.
So it wasn't just, hey, I have a good idea, let's build it. The AI actually helped shape the whole thing.
It did. And it was a very deliberate process, according to what we've read. It all started with purpose discovery.
Purpose discovery. Sounds deep.
Well, it's about aligning your interests with a real need. So the entrepreneur identified this massive need for better healthcare access in rural areas. That became the platform's core mission.
I see. Understanding the why before the how.
Exactly. And then came problem identification.
Okay, so that's where the AI really kicks in.
Yeah, this is where it shines. The AI analyzed all this data about healthcare challenges in rural India.
So they weren't just relying on anecdotes or assumptions.
Nope. Data-driven insights. And that led to pinpointing those specific problems we talked about. The low doctor ratio, the distances, the slow emergency response times.
So they knew exactly what they needed to address.
Precisely. And then the AI did this market validation.
Market validation.
Yeah.
So like, is this idea even worth pursuing?
Exactly. It assessed the feasibility and potential impact, analyzed things like demand for the platform.
And what did they find?
Huge demand, like a 9 out of 10 score. Unmet needs all over the place. They looked at the technical side, too, how feasible it was to actually build this thing, scored a 7 out of 10.
It's so doable, but with challenges.
Right. And importantly, they also validated the potential revenue, how this thing could actually be sustainable.
Okay, so it wasn't just a pie-in-the-sky idea. It had to be practical.
Had to be. And then came the solution generation phase.
So this is where they actually built the platform.
Yep. Using all those insights from the previous steps, the AI helped define those key features. The low-bandwidth telemedicine, the tools for health workers, the diagnostics, the emergency response system, everything tied back to those problems and needs.
Okay, so the AI was like the architect, making sure everything fit together.
A very smart architect.
I like it. Okay, so let's break down those features. What are the biggest benefits for the patients themselves, those rural communities?
Well, for them, the biggest thing is access to doctors without having to travel.
Right, that's the whole point.
Video, audio, even text consultations. No more long, expensive journeys. And then those digital health records, that's a game changer too.
In what way? Continuity of care. They don't have to explain their whole medical history every time they see a different provider.
Oh, yeah, that would get old fast.
It would. And then the coordinated diagnostics. That takes away a lot of the burden, too.
Yeah, the 30-kilometer trip for a blood test, that's just not sustainable.
Exactly. The platform aims to bring those diagnostics closer to the patients, maybe through those local health workers with the mobile kits.
Makes sense.
Yeah.
And the emergency response system, that's got to be a relief too.
Huge relief. Faster access to care, potentially saving lives.
Okay, so that's the patient side. What about the doctors and clinics? What's in it for them?
Well, for one, they get to reach patients they wouldn't normally be able to. Expands their reach to underserved communities.
Yeah, I could see that being appealing.
And those digital tools, they make consultations more efficient. They can potentially see more patients. Plus, there's this clinical decision support built in, gives them access to the latest medical info and best practices.
So they're better equipped, even in remote areas.
Exactly. And it opens up new opportunities, new markets. They can help more people potentially grow their practice.
Sounds like a win-win. We can't forget about the community health workers, though. They're often the first line of care in these rural areas.
Absolutely. And the platform empowers them in a big way.
How so?
Well, those mobile health kits with the diagnostic tools let them do more in the field, more comprehensive assessments. Plus, they get remote supervision from doctors.
So they're not out there on their own.
Nope. They've got expert guidance when they need it. And there are these structured protocols for common conditions.
So a consistent approach to care.
Yeah, evidence-based. And there's even potential for professional development, ongoing training through the platform.
So it's not just reaching more patients, it's about strengthening the whole system.
That's the key to long-term success.
Absolutely. Speaking of long-term, how does this platform plan to stay afloat? Is it sustainable? And can it scale up to reach more people?
Good question. They've got a hybrid revenue model, which is smart. It's a mix of different things.
Okay, like what?
Well, there are partnerships with government agencies and NGOs.
So public and philanthropic funding.
Right. They recognize that this is a shared responsibility. Then there are tiered consultation fees.
So patients pay something? But it's adjusted based on their income.
Exactly. Affordable for rural populations,
Yeah.
and then there are subscriptions for healthcare providers.
So doctors and clinics pay to be on the platform.
Yep. And they're planning to add some value-added services later on for specialized care coordination.
I see. So multiple revenue streams to keep things going.
Right. Diversified approach.
But what about scaling up? Reaching more communities?
They've got a phased growth plan, very specific milestones.
Lay it on me.
Phase 1 is a pilot launch in 3 rural districts. They want to get 20 doctors and 50 health workers on board in the first 3 months, aiming for 10,000 consultations in the first 6 months.
Ambitious?
It is. And they want to reduce patient travel time by 40%.
Okay, so measurable goals.
Yeah. Later phases involve expanding to more districts, building stronger partnerships, getting the diagnostics and emergency response fully up and running, launching those provider subscriptions.
And the ultimate goal?
Reaching 500,000 patients across 50 districts within 3 years, with real improvements in key health indicators.
That's a huge undertaking.
It is, but they seem to have a solid plan.
Okay, so let's talk tech. I mean, this whole thing relies on technology working in some pretty challenging environments.
Right. They've had to be very specific in their choices.
So what are some of the innovations they're using?
Well, the telemedicine part, it's bandwidth adaptive, uses compression techniques, prioritizes essential data.
So it works even with slow internet.
Exactly. And there's AI-assisted triage, helps prioritize cases and guide those initial assessments.
AI popping up everywhere.
It's a powerful tool. And the medical record system, it's offline first.
Offline first, what does that mean?
So health workers can access patient data even without internet.
Oh, that's crucial out there.
It is. It syncs automatically when they get back online. And they've integrated those mobile diagnostic devices. Plus, there's this geospatial emergency routing.
What's that?
It uses location data to optimize response times.
Even in places without proper addresses.
Yep. They've thought of everything.
It's impressive. But it's not just about the tech itself, right? It has to be usable for everyone, even people who aren't tech savvy.
You got it. They've focused on accessibility at every level, compatible with 2G networks, voice-driven interfaces, multilingual support.
So people can use it in their own language.
Absolutely. And that offline-first design, that's huge for areas with intermittent connectivity. They've even considered power efficiency.
Wow, that's thinking ahead.
They've really tried to cover all the bases.
Okay, so we've covered a lot of ground here. What are the biggest takeaways from this deep dive into the 15B platform?
Well, I think the main thing is that this platform offers a really comprehensive approach to healthcare access in these underserved rural communities. And that AI-guided development process, that's what sets it apart.
Yeah, it's a unique aspect.
It is. They addressed specific barriers with tailored technology. They've got the telemedicine, the tools for health workers, the emergency response, all working together.
A true ecosystem.
Exactly. And the potential benefits are huge. The source material suggests they could reduce the time it takes to get care by 1/5 and the cost by 1/3.
Wow, that's significant.
It is. And it's all designed with the needs and challenges of rural communities in mind.
Well thought out.
Very well thought out. And it kind of raises a bigger question, you know? It makes you think about how technology, when it's used strategically and ethically, like it is here, can tackle these huge societal problems, and not just healthcare.
Okay, I'm listening.
What other seemingly impossible problems could we solve with this kind of ecosystem approach, where we combine technology with a real understanding of what's happening on the ground? It's something to ponder, for sure.
Yeah, lots to think about. Really fascinating stuff. Thanks for breaking it all down for us.
My pleasure. It's an exciting development, for sure.